Good morning, everyone. It is Thursday, January 20th. Welcome into the Morning Medical Update. Thank you so much for joining us today on Facebook and on YouTube. Two metro Kansas counties either have the lowest number of people vaccinated in the metro or are battling high positivity rates. Either way, the numbers aren't great for Johnson and Wyandotte County. Joining us this morning to talk more about that is Dr. Alan Grenier. He's the medical officer for the Unified Government Public Health Officer. Dr. Joseph LeMaster is hopefully going to be joining us here any moment. So we will wait for him. Good morning to you.
Good morning.
Lots to talk about. I will get with you here in just a moment. You guys are going to kind of help us break down your counties by the numbers, what it means now, what it could mean later.
Yep.
So make sure to get your questions sent into us on YouTube, Facebook, and on the Medical News Network. You can find links right there on your screen. But first, let's go to our COVID count. Dr. Dana Hawkinson, good morning to you.
Hi. Numbers are holding fairly steady. 100 active infections at this point in time. 21 in the ICU, but again, a large proportion on the ventilator. 15 on the ventilator. 78 additional patients in that recovery period, so a total of 196 patients. We did have one inpatient death on the 19th, so in the last 24 hours as well. So we still have a high rate of mortality, unfortunately, for the month of January. And I would just like to say, Dr. Grenier, you did excellent on your commercials. I think you're a great representative for public health in Wyandotte County.
I wish we had that. So this is a campaign you did with KDHE.
Yeah.
You were one of, I think, 10 or 12 different folks that had different stories to share about their experience with COVID. And what was your message?
Really just that I think with all the data we have, we know these vaccines are very safe and very effective, and we want to motivate people to get them. I had a story about a patient of mine that's a longtime patient of mine here. In fact, saw lots of physicians here and was a great guy, and we lost him to COVID last year. And I wanted to share that because it was, emotionally impactful to me. And I think that's one of the reasons why, we need to keep working on this.
It's tough. And you're a physician, and a lot of these folks were just regular folks who have had, rough times. But, you're a physician. You suffer just like the rest of us watching people lose their lives to COVID.
Yep. Everybody's had stories like that, I think, around here, and we have patients that that have a lot of problems, but they still have great quality of life, I think, because our system keeps them rolling and out there doing the things they want to do, which is the goal. And to lose people to this disease is just it's sad, and it's been impactful for everybody. I mean, I know the nurses have suffered, and I know physicians have. We've all seen sad stuff. So,
well, thank you for that segue over into what I want to talk about first before we get to our topic. The stress on the health system here and across the region has been made clear. We talk about it every single day. We begin this morning with a look inside our emergency department, where staff work constant and tirelessly to make sure whoever comes through those doors are cared for.
Last night, when I was working, we had probably 5 or 6 patients that we sent to the ICU over my shift. You also still have the patients that are in the waiting room, which can be anywhere from 5 patients to, I've seen as high as 52. Being a hospital with 55 beds, and then having just as many patients waiting as there are in the department. I hear we need an IV. Are you okay if I look with my machine? Our beds are at capacity, staffing is at capacity. This is KU, go ahead. And every day I look at that board. Do you need an escort? Typically, on average, 10 to 12 hospitals in the city are on high volume. All right, we'll see you on arrival. KU clear. They are notifying patients that are gonna be arriving that they're gonna probably end up in triage. When you come in by ambulance, that doesn't guarantee that you're getting a bed, because we still have to take the sickest patients first. Morgan, you doing okay? And while yes, a lot of it is COVID, there is also a lot of just sick patients in general. Nicole, do you need anything? Staff has been feeling it for sure. I've been a nurse down here for 5 years, and we are probably the busiest that I've ever seen us. So if patients are here solely for MAB, please let Heidi or I know. What keeps me coming back? In triage, Casey is at T1. The team, Allie and Nick are in the front hall. I really enjoy the team that we have down here. Thank you all. Knowing that I get to show up and be here for these nurses, and that they do the same. We have a really good team down here in the emergency department, and I feel very grateful to be a part of it, and that I get to be there to support them.
Dr. Joseph Lemaster, Johnson County Public Health Officer. How are you today?
Good, very, very good. Good to meet you.
Good to have you.
be
So
here.
just you see this, you work your peers, your doctor friends that tell you what's going on inside these emergency departments. I mean, we know they're down there hustling it all the time outside of COVID, but then you add COVID. Just kind of what's your response and your reaction when you see these folks down here just making it work? It seems like they're always just making it work, getting patients in and out and where they need to be. Your thoughts, Dr. Lemaster?
Well, I think that the main thing that we are seeing and that is an encouragement to us is that as we are getting to the peak of this current surge, the Omicron surge, we're starting to see some of our staff come back. And that is a great encouragement because as the numbers have picked up in the hospital, we've had the greatest concern that we might not be able to care for everybody with the number of staff that were out sick as well. If the number of staff begin to come back, then our capacity to be able to take care of the increasing numbers that we'll see both in the outpatient setting and in the inpatient setting is we have a lot more encouragement and a lot more hope.
And that's just something that I don't think we have seen. You know, we talked about this influx of patients, but now you add the staffing issue. And again, these aren't just staff that are out because they have COVID. I mean, these are staff that have to stay home with kids who are sick with COVID or kids who have schools that are canceled. I mean, it's just a very compound problem. Dr. Greiner?
Yeah. I mean, I really commend the different staff, but both here at our health system, but really all across the country. I think people's ability to be flexible and put their career as sort of a calling, you know, out there on their sleeve and take the tough pieces of this. I mean, my heart goes out to the nursing staff and the respiratory therapists and the nurse aides. You know, in the last month, I think the things people have gone through have been really incredibly tough. And we're almost at 2 years of this kind of strain on people.
And they're still doing the same work day in and day out. And that's why we take folks behind the scenes so that they know. I think when we call 911 or we go to an emergency room, we just assume that's where we can always get help and staff is always there ready to make sure our needs are met. But it's a really rough time for everyone. I want to talk with both of you about the numbers. Dr. Greiner, let's just talk about how many cases are high in Wyandotte County right now. What are you seeing? Up, down, and where are we going?
Very high. We're about the same level as we've been here for a couple weeks. I think yesterday we had our 7-day average was 483 cases total. So these numbers are as high as we've been throughout the pandemic. We can't keep up with contact tracing. I think all of us in the public health realm and at the state level at the Kansas Department of Health and Environment, no one can keep up with that contact tracing and making those calls to people now. So we're trying to do education other ways. Our percent positivity, we're putting it out there in two numbers now, a sort of traditional number, that's 33% of all the tests that get done are positive. And then for those that have never had COVID in the past, we have that number out there too, which has been in the high 60s to even 70% of people who haven't been tested before.
So back to the contact tracing, is that what's adding, do you think, on top of just the lack of vaccination, positivity rates, not being able to contact people, or is contact tracing just kind of a thing of the past? You're on your own?
Well, it's becoming that way. The sad thing is there's so many things we can do, though, when we get a hold of somebody. We can do a lot of education on the phone with them, and we can also do things like we've been providing them letters. I think they have at Johnson County, too, where if they need something for their employer, we can literally provide that to them. So if they can't get into their doctor's office in a week, they've got that, so they can take the time off work and have an excuse to do that.
So you look at this as an opportunity to reach someone, to actually have contact with them, to educate, get them maybe vaccinated. Or
so when this surge started, we tried to sort of prioritize some people that we would, if we couldn't keep up with the hundreds of cases a day, we would at least try to get a hold of 50 people who we thought were the highest risk people, the older people, the people who, maybe the middle-aged people who we know work out in the public sector. We want them to, if they're symptomatic, to take that time off of work. So we wanted to do that education.
let's talk about vaccines. How are we doing on the vaccine front?
Oh, well, not so great in Wyandotte. We've really had a struggle, and we've done all sorts of things to try to get around that. But we're only at about 58% for those that have had a first dose of vaccine, about 49% of those that have been what we considered fully vaccinated. But for boosters, we're only at about 16% as a county, which is really low. And then in the 5 to 17-year-olds, we're lagging too. I think we have 40% of those with a first shot, but we've got to get second shots, and we know I'm sure Dr. Hawkinson's talked about it before. We've got to get boosters into arms to protect people as much as we can.
Doc Hawk, why do we see such low booster numbers? We see 57% about, you said?
With a first shot, 58%, yeah, but only 16 with
16 with that booster. I mean, let's just talk about the booster effect.
Yeah. Why are we seeing so few, or why is there such a smaller percentage? I mean, I think there are a variety of reasons. For the same reasons maybe people were hesitant, there's just a variety of reasons. Maybe they just haven't prioritized the time to go get that. Certainly that can be. Maybe they've had the infection before and feel that with their vaccination and a previous infection, which we know does provide pretty good immunity, they don't have to go get it. But there probably are a lot of those people who have gotten the first 2 doses and haven't come back for that additional dose. And that additional dose really is key, just because of the time point that you are from that second dose, which within that time really allows for that immune system to further develop. And then that additional dose, that third dose at that 6 months or more, really helps to provide that boost to that full immunity. So it's unclear exactly why. I'm sure there are a variety of reasons.
Dr. Lemaster, you're up next. Okay, let's talk some numbers in Johnson County. What can you tell us?
Well, I think that the numbers are very much similar to what we've seen in Wyandotte County, except that the population, of course, is 4 times that. So we also have seen record numbers of cases that are really astonishing. The case rates, our case diagnosis rates, about 4 times that which we saw at any other point during the pandemic. It's been really astonishing. And while there seems to be, if you look at our county website, there seems to be just a tiny little blip coming maybe down. We may be just at that point. I think that there's some evidence that from our wastewater monitoring that we're starting to see some decreases in the wastewater, which previously have predicted a decrease in case numbers. So we are hopeful that we'll start to see some of that come down. But still, the numbers are astonishingly high. And I think the thing that has been that we have to be careful about at this point is, as we start to see the numbers come down, we don't yet know what we're going to be facing in terms of the hospital systems and the number of people that are going to need to be hospitalized. We too are in the same situation in terms of vaccination numbers. We're still very much behind where we think we need to be. The biggest concern, of course, are in the youngest group of people who have the lowest rates of vaccination.
What age group is that? Are we talking kids or teens?
17 unders and the kids as well. If you look at the rates of vaccination across every age group, it's the highest in the oldest age group, and it goes down, 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 all the way down to the youngest age group. Some of that has had to do with the timing effect, right? They didn't get started until later. But we haven't seen the same rate of increase in the kids that we did with some of the older groups. And so at this point, we feel like that pretty much everybody who has had an opportunity to get vaccinated. So now the issue is, will you choose to get vaccinated? Will you do it?
That was my next question, because I feel like you both sound like a broken record from the last time you were on here, and I'm not happy about that. But why do you think it's been a stall out? What is that? From what you see or what you hear or what you know of these folks living in these areas? Well,
there are 2 things going on. One is that there is a certain amount of vaccine hesitancy happening. There is a group of people who will never get vaccinated no matter what you do. They've decided they either don't believe in vaccines generally, or they don't believe in this vaccine for whatever reason, for whatever information they've heard or they've believed, and they've adopted that. But there's also still groups of people who we haven't reached. Some of our more under-resourced minority populations, underrepresented minority populations, we still are trying to get the word out so that if there's any misinformation or there's any lack of information about it, the hesitancy doesn't necessarily work in each group in the same way.
Right. That makes sense. What are you seeing? Because you have a lot of unreached groups.
We do, and I think we've got a lot of people with complicated lives. You know, in Wyandotte, we have a lot of families where the parents are working 2-3 jobs. They have trouble getting to our sites. You know, so we've changed the hours. We've done a lot of weekend things. That seems to be successful. We've done, as I think we've talked about before in here, we've done a lot of things with churches. That's going to continue for us because people trust those those institutions. But people's concerns are all over the map. Some of them, it's not terrible that people have concerns and want to be safe with these things, but it's all about balancing. And I think we've come to a time where there's so much information out there. And I always encourage people to do their own research, right? People talk about doing that. Find out information, but there's so much information out there, it's really hard to process. And we do have experts like Dr. Hawkinson, who he's going through information all the time to figure out what medicines work for infectious diseases. And it's a complicated process. There's tons out there in the scientific literature, let alone everything else on the internet. So I think we have to find ways to get on the side of where the authority is and make smart decisions that are going to keep people healthy. It's tough, but we've got to keep trying.
And I think I like that you said people have complicated lives. It isn't just everybody's an anti-vaxxer,
right?
Or uneducated, or doesn't get it, or they're dumb. This is about, you're right. There are people who say, I don't want to get the booster because I have to work. I don't want to be out of work a day. I can't.
Right.
I can't risk that. I just think it's important to remember that. I think we kind of build that compassion back into it to try to understand and meet people at whatever level they're at, right?
Yeah. It's interesting that you say that. I had a conversation actually with my brother-in-law this weekend, that same conversation, and he was saying, I can't afford to be out of work for 2 days because if the vaccine makes me sick. And I said, well, do the math. How long are you going to be out of work if you actually get COVID, if you actually get Omicron? And he had a friend who'd been out for about 6 days and was in bed for 6 days. So that even if you factor in the possibility that you might be out for a day or even 2 days, what's it going to look like if you actually get COVID and you're quite sick? So you could be out for a much longer period than that.
Why are people so darn hard on the vaccine, but they're not as hard on COVID? It's like...
Yeah, I mean, I've talked to some rural colleagues who are doing monoclonal antibody infusions, right? And this is before our latest shortage on those, but they'd have people who are very anti-vaccine, and then they'd get sick with COVID and want to come in and get a monoclonal antibody treatment in the small hospital emergency room. And it's like, okay, how is your theory about science and safety different with a vaccine versus an infusion of this product that was developed probably by the same researchers that have been involved in developing? It's tough. We don't want to blame these people. We got to still be on their side. Mm-hmm. I always think of it like, I'm sure Dr. Lemasters had this experience too. If you have a new diabetic, they sometimes don't want to accept that and get on insulin shots, right? Mm-hmm. But we can't blame them for that. If it takes us 2 or 3 months to get them on the right medicines and convinced to do that, we have to be, it's our job to be on their side and be open-minded about it.
Absolutely. You agree, Dr. Lemaster?
Yeah, absolutely. I think that all of this is an ongoing conversation, which is one of the reasons why we've pressed so hard and why it's now possible for you to get, in most places, to get a vaccine with your own primary care doctor in your own clinic. You have an ongoing relationship with that doctor. You trust that doctor. Ask that doctor, what should I do? That doctor probably can get you boosted, probably can get that vaccine right in your own clinic. If they can't, then they'll have something set up where you can get it. So, relationships with our own doctors are really important. And we, of course, in the KU health system, we have a very robust system of primary care, and we try and make it possible for you to get in to see your own doctor that same day if you need to.
That bringing that comfort, that reassurance.
Yes.
But yeah, it's all about reaching the unreachable.
Yeah.
Okay, so I want to ask you about something, Dr. Lemaster, in Johnson County, those 3 cities that put the mask mandate back in, Mission, Roland Park, and Prairie Village.
Yes.
Does that move the needle? How much does that help? What does that tell you?
Yeah, I think it's extremely good to do this. We want to continue to encourage mask wearing in every situation that we can because we know that it works. We know that it cuts back transmission. We continue to encourage everyone to be wearing masks in indoor situations where they're with groups of people. All of the things that we've been saying right the way through the pandemic. In Johnson County, we've also stepped up our recommendations for people to use more than just a single cloth mask, if they can, to use double masks, because that also has, we believe, at least as much effectiveness as what we've had before. Maybe it will have some additional benefit. At a county level, we haven't put mandates in. We've deferred to the school districts to do that and to the local municipalities. Part of that has to do with the enforcement issues of how to make that actually work. But the most important thing I think that people can do still, is going to be getting that booster. The booster probably, in my mind, has more effect at this point than any of the other things that we could do, because Omicron is so highly transmissible. But certainly, I would encourage people not to be gathering unmasked in any indoor type of gatherings at all. That really should not happen. Any indoor setting, I think.
Okay, we hear you on that. Boosters are key. I want to go back to masking. What's masking like in your counties? And I live in Johnson County, and I was been very impressed in some areas. That I went somewhere yesterday and it scared me, so I left. So
yes.
I get like, wow, really proud of you folks. And then I'm like, oh yeah, you're not doing it right. So tell me, just kind of paint the picture of what masking looks like in each county.
Yeah, I mean, we had a mandate for a little bit longer in Wyandotte County. How much that helped us, I'm not sure. We had problems with enforcement too, but I do think it's one of those things where you kind of need societal buy-in. It's I keep comparing it to stopping at red lights or not taking a right turn on a red light if there's a sign that says you shouldn't. It's like we're trusting people to do this so they don't get in car wrecks, and we need to buy in on the mask thing, especially when we're having surges like this. As Dr. Master says, any indoor space where you're around other people, you should have a mask. And I agree with him, a high quality mask, like either double masking with a cloth and a disposable surgical mask, or a KN95 or something like that is valuable at this point in time when we're in this big a surge.
I'm glad you brought that up. We're doing Masking 101 right here on the show tomorrow.
Yeah.
So we'll be talking about that. We're kind of going back to basics because I think people are listening. Maybe people who weren't wearing a mask before saying, hey, I think I want to jump on that train. And we want to make sure they're buying the right ones and wearing them the right way. So we're happy to go back and do that. But you meant it's not just the mandate, it's the enforcing.
Yeah.
That's the challenge, right?
Yeah, that's right. I mean, you have to think about the fact that if you put a mandate legally in place, and then there are infractions of that you have to have the sheriff's department or the police department going out and issuing citations. They've got a lot of staff that are out also. They've got the same sort of situation that we've got in other in every other sector. I think what we've tried to do in every way that we could was to encourage people to do the right thing, to appeal to people's sensibilities, to the fact that they're adults, that they're educated people, that they know how to protect themselves. But we continue to see, especially in retail sorts of situations, in restaurants, in churches, people continuing to gather in large groups. And that's because there is no mandate against it. They have the freedom to do that, but that doesn't mean that it's wise to do it.
Well, and when we had a mandate, it felt better when we had to, but now you're having to make that decision on your own. No one's telling you to do it. You just have to go, oh, aha, I need to wear a mask.
Yes.
And there are places where as you know, it's become very politicized across the state. The rural areas, it's a big issue where people they're still feeling like it's some freedom issue. Mm-hmm. But think about this place, this hospital. People wear masks when they come here. And the surgeons, when they operate in the operating room, the surgeons have been wearing masks for decades, right? You don't find surgeons who start talking about their liberty and their freedom. They're trying to protect their patients in the operating
and themselves,
room.
yeah.
And
of course.
when you walk in this place, there's cancer patients who are immunocompromised here. Yeah. Everybody's wearing a mask in this building. So there are environments we can do it, especially when there's a surge going on. We have to get on board. It's very similar to like indoor smoking bans when they first started a couple decades ago. That took a while for everybody to get on the same page.
Oh, it still blows my mind. I used to wait tables and I thought, oh my gosh, I used to have to ask people, do you want smoking or non-smoking?
Yeah.
And I'd be moseying through and I thought, wow, we've come a long way in a time you thought, wow, this is how it used to be. Not the case anymore.
Yep.
You bring up, being politicized. So I have to ask you because we had Mayor Quentin Lucas on yesterday. So, and that question is asked, Mr. Mayor, why can't you just put the mask mandates back in place and wave your magic wand? Tell us a little bit about how you two on the county level work your way up to have your voices heard, have your people's voices heard as you lower your head. Tell us how easy that is, Dr. Lavasser.
Yeah, well, not very.
Right.
I think the thing is that we, at least in Johnson County, I feel like we've had a better situation than many counties had across the state because we have a group of commissioners who, in the main, are working very closely with us, listening to us, talking to us. We consult with them regularly. We have county managers who are very reasonable and work with us. So I think that we've been able to have really good conversations right the way along. You know, even when I had the authority to pass public health orders that was independent of them, I always consulted with them in everything that I did. We never did anything independently ever. But I think that on the other hand, they also are having a lot of voices coming towards them, many of which are tired of the masks or see them as harmful. And so it's hard for them to balance all of those things. And, you know, the voices of the people that are in their ear. Remember that now we're in a situation where the boards of county commissioners actually have the final authority to pass the public health orders. It's not in the hands of the public health officers anymore. The commissions do that. And so it's really just a case of trying to bring the data, trying to bring the science that it's been emerging, making an argument for those things which are reasonable to do and which we think are going to make a difference. I think that the point right now, though, that I'm mostly trying to talk to them about is for us to be looking very carefully at all of what we need to do to support the hospitals going forward into these next few weeks. I think that this is really a key time for us to be looking at what we've got in place in terms of our staff, for our infrastructure, for the hospitals, to be able to make sure that everything is ready if we start to see these numbers go up. And to me, that's the more important thing for us to be doing at a county level at this moment. You know, I think that it'd be great to pass mask mandates, but when when we've got the numbers that we've been seeing recently in terms of cases, and we know that is always followed at 2 to 3 weeks later by a rise in the number of hospitalizations, to me, it behooves us more to put some emphasis on making sure we've got everything in place to be able to manage that when it hits us.
What are your thoughts, Dr. Greiner, on that?
You know, these things it's a balance, and this has always been true with public health. You know, if you look at the history of public health and the different infectious diseases that it's trying to control, you want to balance individual freedoms with what's good for the collective. And we've been lucky too in Wyandotte County that we've had a close relationship between the public health department, our leadership group, and the county commissioners and the mayors. We have a new mayor, Mayor Garner. And we're always trying to work with them to figure out what's the right balance and how to get the buy-in of the population for some of these things. Just again, it's about protecting the community, protecting our hospitals and these burnout nurses that are working here in the ER like we saw earlier, or up in the ICUs. It's you know, we got to come together on some of that. So we're always trying to work closely with them, and we want to keep doing that. And we have to have that. We have to have close working relationships with governing officials.
Well, and you're right. You're the voice of your people and these healthcare workers as well. So thank you for sharing all that you see and all that you know. Let's get to some community questions today. We've got some good ones. Peggy wants to know, how do you encourage people who are vaccinated and have had COVID to continue to wear masks, or do you? Is that an important factor?
Yeah, well, there's a couple of things to say about that. The first is that we know that still, even people who have had vaccination, even people that are boosted, can be infected with Omicron. And they may have very mild symptoms, maybe not even any symptoms. So remember that the whole point of wearing the mask is to protect your family members, your neighbors, your colleagues. So it's not about you at that point. It's about the other people around you. Even if you have a mild a case of COVID or Omicron, you may not know that if you've been boosted. So it's important for you to wear that mask so that you don't unknowingly pass that on to somebody else.
Donna has a question. Dr. LeMaster, don't you think that there are some people who will actually follow a mandate if it is in place, and if it is not, they don't wear a mask anyway? Isn't getting that group to mask important enough to put a mask mandate in place, like a force?
Yeah, well, we've of course had that conversation at the county commissioner level, and the general response back to that is, if it's possible to do that, then it certainly seems to be an advisable thing to do. But you also have got to take into account how are you going to make that work. We talked about this already, the whole enforcement part of that. I think the other piece of that is that we've seen sufficient resistance on the part of of the population that doesn't want a mask. So that when we put mandates into place, sometimes we end up getting a reaction to that among those who don't want a mask, which makes things even more dangerous. So then you start having people intentionally going into situations because they can, you know.
Is this where you bang your head against the wall?
Yeah,
It's like-
you can. I think that's right. I
Not-
think that's right.
That is tough. Okay. I just like this conversation because I don't think people think it's just the situation is different than it was last time when we first put the mandates in
Yeah.
and there was no vaccine, and then you lift the mandates. It feels like a whole new element. It's very different.
Yeah, it's interesting these surges and what we're learning and what we're not learning. You know, we obviously probably could have learned more before Delta, that surge. We probably could have learned more before this surge, before Omicron. We're probably going to have another surge, right, down the line. So I think, and the other thing we've learned, which is a hopeful thing, is that these vaccines work,
Yes.
and the boosters work, and we don't have these variants escaping that immunity that the vaccines create. So how in the next couple of months, if we have time before the next variant arrives, how can we get more shots in arms? I think we're not even learning the lessons that are simple common sense.
So you're saying when these surges hit, it's like try to, again, reach the unreachable, get them so that they're prepped for the next surge.
Yeah.
Yeah.
And so on and so forth down the road.
Yep.
Okay, Let's Go has a question, and Dr. LeMaster, I think you said this, that there are just going to be some people who don't get it, the COVID shot.
Yeah, okay.
At what point do we just decide to respect their decision and trust the vaccine keeps those who do get it safe? I'd like to hear from both of you.
Yeah, I mean, I think that we continue to push forward into trying to get as many people vaccinated as we possibly can, and really who will. I think what that sort of question is suggesting is that each person makes their own mind up, and if they choose not to get vaccinated, then they're not protected and they put themselves at risk. But it's not just, remember that vaccination is not just about your individual risk, it's about the entire community. The more people who are vaccinated, the closer we get to a place where Omicron or the next variant that comes down the pike can't replicate, can't transmit as quickly. We've talked about herd immunity from the very beginning. Vaccination is not just about you, it's also about the community. It's about your neighbors, it's about your family. So
That's sometimes the hard message
that's
to
the
get
hard
out there,
message.
right?
Yeah. Well, and historically, especially with childhood vaccinations, which, again, if you look over the last 50 years, the dramatic impact of childhood immunizations has been massive in our country and really across the globe. I'm sure Dr. LeMaster, like me, we remember more kids in the hospital when we were early in our careers than we've had the last 15 years because the vaccines they work so well. But you do need that herd immunity, and I think that works somewhat with measles and pneumococcal vaccines. But we found with the Delta and Omicron variants, it's a huge number to get to herd immunity now, higher than I think any of us expected early on in the pandemic. And so again, it's about protecting your neighbor. It's like running stoplights, right? If we have 5% of the population that just goes, I'm going to run all the stoplights because I don't want to stop and I'm in a hurry, there's going to be a lot of fatalities on the streets. And people don't do that. 5% of our population does not run all the stoplights. So we've got to figure out how to get some really high number like that with this going forward to get this to go away. And that's got to be both in the U.S. and internationally, or we're going to have more mutations.
And we get the herd immunity question is asked almost daily. What's your insight on that, Dr. LeMaster?
Well, I agree with Dr. Greiner. I think that the issue that we need to begin to think about much more. Remember that the current Omicron came out of a situation from a country where it didn't have the kind of vaccination coverage that we do. Global vaccination, pushing the global vaccination agenda is an extremely important thing for us to do in this country. I think the other thing, to remember is that we're fighting now against a sizable part of the population that doesn't trust in science. I remember as a kid lining up in a park, a line a mile long to get my polio sugar cube, right?
My mother told me that exact same question. She said we would line up around buildings. Nobody even asked a question. We just ran out and got it.
We just did it. And because there was a trust in science at that point. We've lost a lot of that confidence in science over the last few years. And so we're fighting uphill against that. nonetheless, we have to continue to press forward in every way we can. And a lot of that, I think, depends on, it's kind of what we're working on. Dr. Greiner and I are working in a project right now where we're looking at many different means of communication, of messaging, of trying to understand where people's perspectives are so that we can reach them and that they might be willing to change their mind. There's a lot of people still kind of sitting on the fence about it, who haven't quite made up their mind that they will never get it. And that's the group of people we need to reach.
Well, and again, I go back to there's the scientific part of it, and then there's the mental, psychological part of it, really getting to understand somebody personally, where they're coming from on the inside and their experiences. Everybody has a different experience.
Yep.
That gets them to I used to say all the time, I go, it's nice that I get to sit here on a desk with all these smart doctors surrounding me and I get all my questions answered. So it was no problem for me to go do it or to go take my children to do it.
Yeah.
But that's not fair when I have friends who have children who love their children the way I do,
Yeah.
but they don't have that advantage. So,
Right.
and I can't imagine how, I know there's, again, the unreachable. Donna has a question. How concerned are both of you about the legislative and political attacks on the public health system, the authorities, that kind of fighting the good fight in Kansas and Missouri? Why would anyone want to work in public health if they have no tools and no one's listening? And how damaging could this be for healthcare overall down the road? Certainly when it comes to workers.
Yeah, I think that's a major concern. We've talked already about burnout nurses and nursing staff and hospital staff, respiratory therapists who have struggled through this whole pandemic and are really hurting right now. And their families are hurting, right? But the same is true in public health. I'm sure you're seeing it too. We've got, especially our staff that have been there through the whole pandemic, our lead epidemiologist, Elizabeth Gronway, she is phenomenal, but she is fried at this point. She's emotionally labile, and we're all trying to support each other because those attacks have continued to roll in, and it's amazingly hard to keep doing your job when many people doubt it, and you're just trying to help people. These aren't high-paying jobs we're talking about here, so. We've got to support public health for the long term and figure that out too. I don't know exactly what the answer is, but some of it I think is about just saying that this is a helping profession. It's very similar to healthcare.
I have another question I want to ask you before we get to some final thoughts. But Dr. Hawkinson, Victor wants to know, he's tested positive for COVID. When should he get another test to say that he's negative? Do you need to do that? Do you need a test to say you're negative, or do you just wait out the time period?
We would just wait out the time period. There's not a recommendation to really test negative for that. That's been fairly consistent through the pandemic. One of the things that has been consistent through the pandemic is we really don't need to retest, after a certain amount of days. And some of that may depend on what your county or your state health department is saying it's okay to do. Obviously, we know there's CDC rules, but I think if you're waiting a number of days, certainly if it's more than 7 days, you're really not going to be infectious and it'd be okay. But overall, the guidance is to not test.
And Marie wants to know, she's vaccinated and she's boosted, but she says she's on day 15 of a low-grade fever and headache. Is this common with COVID? She said she just doesn't feel right. Is that pretty normal?
I think this is an individual health issue, and we should probably have you go see a provider and just look in to see what all is going on, get the pertinent details that we aren't able to get right now, and do an exam and kind of come up with an assessment at that point. Typically, especially if you're boosted, you're vaccinated, boosted, you probably shouldn't be having fever still at day 15, but obviously we know this virus is tricky, and some people do have more atypical symptoms as well, but just to make sure it's not something different, probably just go get evaluated.
All right. Dr. Greiner, you had mentioned something I was asking you before we started the show, just, what are you seeing with your patients, your other job when you care for folks. And you said, the first thing you said mental health is still a big issue. You said that's really never gone away. What made you bring that up?
I think just how much we've seen it in the primary care environment. So Dr. Lemaster and I are both family docs when we're doing our work here, and we have to think about everything that's going on with the patient, whether it's COVID related or it's their diabetes or it's an anxiety issue or a depression issue. I can't tell you the number of people that have had major anxiety problems throughout this pandemic. It really didn't start till about the summer of 2020. I think those early months, people were kind of like, we're all struggling through this together. But then it just seemed like it's been a wave and then worse waves, right, with these variants. And I think this winter we've seen it again in the last month or two. So many anxiety issues, depression issues. People have trouble doing the healthy things that are going to allow them to cope with that, like exercise or do other things like that. And so we have to try to address those issues too.
Yeah. They come in wanting to feel good with the body, and then you find yourself, Dr. LeMaster, having to kind of walk them through all these other issues in their life, right?
Well, absolutely, that's right. On the other hand, I think that it's important to remember, we get a lot of comments about how the masks are somehow contributing to all of that. I think that it's important to remember that the most important thing that you have around you are the people that you're in contact with, your close relationships, and building up those interpersonal relationships as much as you can. We get a tremendous amount of support from those with whom we're in daily contact and with whom we've got close relationships. So being able to draw on those resources that we have is important. And there are many things that you can do. You may not be able to sometime go to the gym to work out, but there are things that you can do at home to stay active, and we can always eat right, and get enough sleep. Those are all things that are important for
And that
us
we
to
can.
do.
Those are the things we can control.
Those are the things we can
Little
control.
things.
That's right. I think sometimes people are sort of anxious about or concerned about those things which are out of their control, but there are some things that are in your control, and those are things that you need to pay attention to and do.
And they matter. Loved having you guys here today. So I want to get some final thoughts from you. Share with us anything that we didn't cover that you want everyone to know. Just give us some final thoughts. Dr. LeMaster, and I'll start with you.
Well, I think that the main thing that I would probably want to encourage people to say, we've said it several times through here, if you haven't been boosted, go and get boosted now. Do it today. This is the most important thing, I think, probably as a takeaway. I think the other thing to say is stay in close contact with your primary care doctor and with your clinic. If you have any needs, make sure and reach out. That's your best first source of getting information and getting help if you need that. And we are going to be here with you no matter what happens going forward through this.
You have a very calming voice, and how great would it be if somebody heard you say, just go get boosted today, and we got one person boosted for watching the show. We always say it's one show at a time, one person at a time, one day at a time, so we'll take it. That's a win. Dr. Greiner, your thoughts?
Well, one of the things I was going to say was the same thing, because I know many of us have had this experience. When people are in the office, we oftentimes can get people to take that initial vaccination or that booster when they've been very resistant to it otherwise. And I've had some amazing experiences like that in the office. It's just a better environment. So I said, I don't know, a year ago or something, I said, we should make this the year of see your doctor twice. Don't just get your annual physical. Maybe this should be the year where we just have a campaign that's like, let's get everybody to see their primary care physician 2 times instead of just that annual physical, because that might open up opportunities to address these mental health concerns we're talking about, address vaccination, whether you're boosted, whether you've got some other underlying complications that need to be tuned up to keep you healthy, whether you need to talk about these self-care things like Dr. LeMaster's talking about, sleep and exercise and drinking a little less, because we've had a pandemic wave of substance abuse too. So I'm kind of thinking maybe 2022 is the year of stay in touch with your primary care physician and think about seeing them an extra time this year.
Build that relationship, and if you don't get them on the first time, answer some questions, and maybe the next time they come back, you've got a fully vaxxed and boosted patient, ready to go. Thank you both so much. We appreciate you always. Dr. Hawkinson, final thoughts today.
I would just like to thank our public health officials. We have 2 great doctors here who are looking out not only for their individual patients, but for the community as a whole. And I think they brought up a good point that a lot of public health officials have been pushed out or burned out for one reason or another. We know there is a myopia in leadership to try and handcuff the ability for us to do public health and have public health guidance and put out the best optimal public health guidance to keep everybody safe. It's those same people that are standing on the giants of shoulders and decades upon decades of public health science and medicine that has come before them, that has allowed them to continue to be healthy, have even things like clean drinking water and overall decreased disease rates. So I think it's important to understand that, and hopefully public health will turn around and we can keep all of those people that have dedicated their time and their lives to staying in that profession to help keep those communities safe.
Thanks, Dr. Hawkinson, and thank you all for being with us today. Don't forget, you can catch our shows anytime by logging on to our Facebook or our YouTube page. Coming up tomorrow, there is definitely a right and a wrong way to wear your mask. Amanda Cackler is back. She's going to show us how to do it right. Plus, Dr. Tim Williamson with what our COVID numbers are telling us about this stage of the pandemic and what's coming up next in the next following weeks. So everyone have a fantastic Thursday, and we will see you back here tomorrow at 8.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.